I'm Taylor Tomlinson. I'm a family medicine and addiction medicine physician here at Northern Nevada Hopes. I've been with Hopes for 2.5 years. So being a physician, I help evaluate patients for substance use disorders, help them talk through their readiness for treatment, their health priorities, their health goals, and then discuss with them their options for treatment. I prescribe medications for substance use disorders, namely opiate use disorders. There are several medications that are important in helping patients reduce or stop their drug use. And one medication in particular, buprenorphine, is really helpful in reducing overdose risk and overdose death from opiate use. So I think that one of the ways that Northern Nevada Hopes helps first off the bat is just by offering patients primary care, offering them a safe space where they can come and discuss their health goals. That's one of the most important ways to take care of patients who use substances, and for patients with substance use disorders is to offer them primary care. Beyond that, for patients who are interested in treatment for substance use disorder, whether it be reducing their use of drugs, stopping the use of substances, or trying to find ways to use more safely, Northern Nevada Hopes has a great team called the MAT team for medications for addiction treatment and substance use disorders that offers medications, behavioral health, including therapy, groups, peer support, case management, really wraparound services for patients to kind of pick and choose how they feel, which treatments will work best with their life and with their health goals. So when we think about recovery and what that means, it's really patient-centered and patient-specific. And I think that Northern Nevada Hopes is unique in how we approach substance use disorders and addiction, first by just offering primary care and offering a safe place for patients to come and address their healthcare needs. Sometimes patients are not interested in addressing substance use disorders or their substance use, and so they have a safe space where they can come and talk about whatever is interesting them in their health or whatever their recommendations for improving their health might be. So that's kind of the first place is offering primary care. After that, when patients are interested in reducing or stopping their substance uses, there are amazing treatments and kind of a team-based approach for what treatment modalities there are that are available. So one of those being medications. There's Suboxone for treatment of opiate use disorder, intramuscular naltrexone for treatment of opiate use disorder, and then a handful of medications for treatment of alcohol use disorder and methamphetamine use disorder. So beyond seeing a medical provider and getting medications, there's also wonderful behavioral health treatment that includes individual therapy, includes group support, and peer management or peer support and case management. So there's really a team-based approach where patients can think about what would benefit them most in their health goals, and that will look completely different for each patient. I think the big ticket item that people like to bring attention to is that there's increasing amounts of fentanyl in the drug supply locally. And what that means is that people can be inadvertently exposed to what is a very, very potent opiate that increases risk of death. The majority of overdose deaths that we've seen across the country in the last couple of years have been attributed to fentanyl. So that's a big risk for our community, for patients who may be seeking fentanyl or maybe looking to use other drugs that are then contaminated with fentanyl. I think that this community needs more access to treatment and easier, low barrier access to treatment. And what I mean by that is that we have very effective medications. Here at Hopes, we prescribe buprenorphine, which, as I mentioned, decreases the risk of overdose, decreases drug use, decreases death from overdose, and then many other things patient cares about, including decreased risk of seroconversion to HIV and hepatitis C, decreased risk of going to the hospital. So this is a really evidence-based, safe, effective treatment that we need to have more of an opportunity for patients to get in the community. And so I hope that more and more doctors and providers can prescribe this medication and treat patients with substance use disorders. I think also patients need access to behavioral health and therapy if that's what they feel they need and would benefit them in their treatment. And so we need, more therapists and more places that offer therapy, insurances to cover therapy. And I think working at Hopes with this team-based approach in substance use disorder really gives patients the option to kind of pick and choose what they feel works for them and works for their health goals. So I would like to see that expand across our community.